Dr. Evelyn Lee. In this video, I will go through nuts and bolts of pellet therapy as one of many forms of bioidentical hormone optimization. Whether it's for you or not, thank you for watching. What is bioidentical hormone replacement therapy? Bioidentical hormone replacement therapy with pellets is a natural alternative to synthetic hormone replacement therapies. With bioidentical hormones, the structure of the hormone, testosterone, estrogen, or both, matches the patient's needs. Bioidentical hormones are natural, plant-based substances that metabolize our bodies as natural intended. Since the hormones are mass-produced and artificially formulated in a lab, artificial hormones are intentionally manufactured to be slightly different than natural human hormones so that the manufacturer can patent the formulation. Therefore, synthetic hormones may not provide a good fit for optimum outcome for the human body as bioidentical hormones do. What are bioidentical hormone pellets and how do they work? Composed of either estradiol or testosterone, bioidentical hormone pellets are larger than a grain of rice and smaller than 8 to 10 millimeter. The pellet is pressed into a tiny solid cylinder. During this, there are procedures. If the provider applies a local anesthetic, it makes a small incision that inserts the pellet into the fatty tissue under the skin, usually in the flank or upper buttocks. The incision is then closed without any need for stitches. The pellets release testosterone or estrogen into the bloodstream based on cardiac output, in other words, due to increased physical activity or emotional stress, good or bad. The steady stream of hormones help keep the symptoms such as mood and energy fluctuation at bay. Subcutaneous under the skin pellets has been used to treat hormone imbalance since 1930s. Even if the patient does not have symptoms, imbalanced hormones may threaten their health. It is important to note that patients with low testosterone or estrogen does not experience common symptoms related to hormone imbalance. They may believe they do not need bioidentical hormone replacement therapy since they generally feel well and their energy levels are up. Unfortunately, this may be a dangerous assumption. While bioidentical hormone replacement therapy via pellets effectively treats symptoms related to imbalanced testosterone and estrogen levels, research also suggests that hormone optimization may help prevent diseases such as osteoporosis, cardiovascular disease, Alzheimer's disease, certain cancers, and others. Who can benefit from bioidentical hormone replacement therapy via pellets and how? As we age, testosterone, estrogen, and progesterone naturally declined over time. Around age 35, they experience a gradual reduction in testosterone, typically 2 to 10% a year. For women, free menopause may start as early as the 30s. Hormone imbalance often kicks in long before hot flashes do by 10 to 15 years. Lack of motivation and feel more tired than usual, gain weight or for no reason, especially at the belly, low libido, experience mood swing more frequently, feel anxious and depressed, struggle with brain fog and insomnia. If these symptoms sound familiar, you may be an excellent candidate for subcutaneous hormone pellet implants. Unfortunately, most traditional medical practices do not take the time to discover why patients do not feel like themselves anymore. Instead, they keep writing prescriptions for antidepressants, anti-anxiety medications, sleeping pills, and other drugs specifically for that symptoms.